Representative Alma Adams from North Carolina, who's by education a teacher, and she taught a very, very long period of time, and she's now a member of Congress, and so she's still teaching. I like to think of members of Congress as teachers as well as representatives. Representative Lauren Underwood, who is the youngest Black woman in the Congress of the United States, and she is absolutely one of the best as well. She served in the Obama administration in the Health and Human Services Department. So in Alma and Lauren, we have the co-chairs of the Maternal Child Healthcare Caucus, and of which I'm a member, and Anthony Brown is a member. Anthony is with us as well. I'll introduce him in just a minute. I want to thank all of the health officers who are on, Dr. Polsky, Dr. Abney, Dr. Kalyana Raman, close, right? Maybe no cigar, but close. Dr. Carter with Prince George's County, and Dr. Braithwaite, who is the director of the Maryland Office of Minority Health and Health Disparities, Dr. David Mann, who's an epidemiologist, Maryland Office of Minority Health and Health Disparities, Tequila Terry, who is the Maryland Health Services Cost Review Commission Director, Tanya Lynn Harris, who's co-founder of the Bloom Initiative and Mommy Up and kindred partner Black Mamas Matter Allowance, and Yema Juliet Sadiq, founder and president of Project Womb. We also have members of the press that are on. We welcome them to us. And this is live streaming on my account.
We're waiting for 2 members of the Maryland Department of Health at the moment, but we're reaching out to them to see if they can get on. But we're gonna go ahead and get started. Start streaming. After who Matt reaches, but you're
where do we get the, we're starting to move. I see
all right.
Anthony's going around. Anthony's getting ready.
All right, the music. But Maya's gonna start and introduce everyone, and then we'll start streaming.
All right, Maya.
On Facebook.
I just introduced most of them, Maya. You might want to
introduce everyone to each other.
Good morning, everyone, and thank you for participating in today's roundtable discussion. I'll turn it over back to you, Mr. Hoyer, in just a minute, but I wanted to go over some housekeeping items before we begin. We ask that all participants please remain muted if they are not speaking. If you would like to ask a question or make a comment, you can always raise your hand or type a message in the chat box. Like Mr. Hoyer said, this conversation is being recorded and live streamed on Facebook. So I'll now turn it over back to you, Mr. Hoyer, to give opening remarks and begin the discussion.
Well, thank you very much, Maya. Anthony and I both, as all of you know, represent Prince George's County and a number of other counties as well. COVID-19 has shown us starkly the disparity in healthcare opportunities and outcomes for minority people of color, particularly African Americans. We're joined today by Alma Adams, who is an extraordinary member of Congress. She's in her 4th full term, but was elected in a special election as I was. Lauren Underwood from the suburbs of Chicago. And she is the youngest African-American woman in the Congress. She is the first woman to represent her district in the Congress and the first African-American to represent. And they went after her hard this time, and she won. She won decisively, a wonderful member of Congress. So Alma Adams and Lauren Underwood have partnered in heading up the Black Maternal Health Caucus, of which Anthony and I are members, as I said a little earlier. So I want to thank both of them, not only for your leadership of the Black Maternal Health Caucus, but also for making it an active caucus that has been busy working on legislation to address the challenges faced by Black mothers and mothers-to-be. Again, I would reiterate, COVID-19 has made very, very clear the stark disparities that exist that are unacceptable. And Alma and Lauren are leading the effort to make sure that we overcome these disparities in the richest country on earth. I'm very proud to have joined both of them as a founding member of the caucus as we introduced the Momnibus legislation earlier this year, which I'm sure both of them will discuss. It is inconceivable that one of the wealthiest and most medically advanced countries in the world would have the highest, this is a sad and tragic and unacceptable fact, the highest maternal mortality rate of any developed nation. How can that be? I know some of the health officers and those of you who represent other organizations and the health department in Maryland will opine on that. But we need to make it very clear to the American people of the starkness and unacceptable nature of this fact. It is even more unacceptable that African-American women are 3 to 4 times more likely to die from childbirth and its complications. 3 or 4 times, particularly when 60% of these deaths are preventable with proper medical care, perhaps a higher percentage. And that's according to the Centers on Disease Control and Prevention. We can and we must do better. Part of this forum is for you to hear from them what we're doing and to hear from you as to what you think, if we're not doing something, what we ought to be doing and how we can do some things better. Through our work in the Black Maternal Health Caucus, I've heard the horrifying stories of women who knew something was wrong during the course of their pregnancy, but had the experience of the healthcare providers not taking their concerns seriously or ignoring them outright. I've heard countless stories, and Alma and Lauren and Anthony and perhaps others of you, I know all of you can point out stark examples of, frankly, disparate hearing and attention from white and people of color by the medical community. As we've all heard the heart-wrenching accounts of family members who lost their wives, mothers, daughters, or their babies to preventable complications of pregnancy or childbirth. That's why the omnibus legislation we've introduced is so critical. And again, I thank Alma and Lauren for their leadership. Together, we bear the responsibility as a nation to ensure that all people have access to the highest quality healthcare available. Very frankly, that was the focus of the Affordable Care Act. Very focally, it's been the focus of other legislation we passed during COVID-19. It got big attention in the American Rescue Plan, and it's going to get big attention in the American Jobs Plan and Human Resources Plan. So this is especially timely that we are having this discussion. We must end these racial disparities in maternal health care delivery and outcomes. I tell people, I have 4 great-grandchildren. They'll all be going to school. 3 of them are in school now. And they'll have a child sitting in front of them, a child sitting in back of them, a child sitting to each side of them. The fact that I can provide, or their family can provide, health care for those 4 great-grandchildren will not be effective if the 4 children that are sitting around them in that schoolroom are not also healthy and have the availability of credible, quality health care, period. To that extent, this virus has shown we are all in this together. So this, yes, it may be talking about Black maternal health, but what it's talking about is our health, all of our health. This is one of the most pressing civil rights issues of our day. And I look forward to continuing to work closely with Representatives Adams and Underwood and Congressman Brown to ensure that the House does its part in responding to this challenge. In Maryland, this is a challenge we've been facing for a long time. And I'm proud to welcome our roundtable today, public health experts from across the 5th Congressional District, as well as Black maternal health advocates serving our communities. I look forward today, important discussion, to hearing from all of you about how the work of improving Black maternal health care in our communities is progressing in our state. And I look forward to hearing further from Congresswoman Adams and Congresswoman Underwood. And now let me turn this over to my co-host and partner in representing the state of Maryland. And we all look at this as one team, one state, and then one country. So Anthony, let me yield to you. Thank you very much for joining us and for all you do.
Hey, thanks, Kenny, and I'll be brief because I know that we all want to hear from Alma and Lauren and also from our public health officers. So let me just start by thanking you, Steny, for organizing this event. I always appreciate the opportunity to partner with you back in our district around issues, whether it's, infrastructure, whether it's the American Rescue Plan, or today, this very important topic of maternal health. So I want to thank you for that. I also want to thank my good friends and colleagues in the Congressional Black Caucus, Congresswoman Alma Adams, who is a distinguished educator, and Congresswoman Lauren Underwood, who is a registered nurse. You didn't include that in her intro.
I didn't include it, and I should have.
Yeah. And Lauren has really been championing with Alma the important issue of Black maternal health. And we're going to hear more about the Momnibus, a very comprehensive piece of legislation to address the disparities that exist, particularly when it comes to maternal health. I share their concerns, and I look forward to getting this through the House, through the Senate, and to President Biden's desk for signature. Certainly want to welcome our dedicated public health experts, our and advocates for joining us today, and thanks for providing your insight and passion. We've seen during this pandemic the significant disparities that have existed in our healthcare system, and were just sort of exacerbated and highlighted during this pandemic. We know that Black Americans are twice as likely to die from COVID-19 as white Americans, and 3 times more likely to be hospitalized with the virus. These disparities aren't new. They're systemic and they're deadly. It's unacceptable that in America, maternal mortality rates are the worst in the developed world. As Steny mentioned, the United States has actually seen maternal mortality increase 16.7% in the last 3 decades, where in most developed nations, that number has gone down. Like COVID-19 and so many other public health crises, for Black Americans and Black women, these issues are even more dire. Black women are 3 to 4 times more likely to die from pregnancy-related complications and twice as likely to lose an infant to premature death. This is a multifaceted problem demanding action at every level, federal, state, and local. We need to tackle not only access issues, but quality issues, and of course, continue to address the affordability issues. Decades of implicit racial bias and systemic issues are embedded in our healthcare, education, and criminal justice systems. And I firmly believe that race-neutral solutions will not solve the longstanding disparities that we face. We need targeted policies that get resources to communities of color and promote equity and empowerment. Since my days as Lieutenant Governor of Maryland, I've certainly fought to close these disparities. I know a number of our public health officers are familiar with what we did together, the Health Enterprise Zone Initiative, to reduce disparities, and we designated zones 5 in rural, suburban, and urban areas, and we saw tremendous improvements in health outcomes. We saw the cost of delivering care went down, the number of hospitalizations and readmissions went down, and we were able to reinvest those savings right back into the communities that need them the most. So that's why I'm glad to see that the General Assembly, the Maryland General Assembly, passed the Health Equity Resource Act again this session after Governor Hogan ended it. And it's why I'm committed to bringing that bill to the floor as well. More health resources to Black and brown communities can and do make a difference in health outcomes. So again, I applaud my colleagues, Alma Adams, Lauren Underwood, look forward to working with you, and particularly how refreshing it is to be able to do it in an environment where we have a president and a vice president of the White House that really emphasize equity. And that's what we need to see in all of the work that we do. So thanks, Steny, and I'll kick it back to you.
Thanks very much, Anthony. And now I'll go to the 2 co-chairs, and we'll start with the senior member in terms of service. She's just been there a little longer than Lauren has been, but she's done a great job of leadership, not only on this, but also she's the chair of the Historically Black Colleges and Universities Caucus, of which I'm also a member. Alma Adams, thank you for being with us.
Well, thank you so much. And I am the senior member, and I'm just glad to be here today. Good morning to everybody. It is a pleasure to join you on this Monday morning, and I'm grateful to be here with my colleagues, Leader Hoyer, Representative Brown, Representative Underwood, and it's wonderful to be joined by so many local public health leaders, researchers from Johns Hopkins, and community-based leaders and partners from the Black Mamas Matter Alliance. Leader Hoyer, I want to thank you for convening this roundtable dialogue on the importance of addressing the Black maternal health crisis, as well as the solutions and the steps that we need to take right away. Your leadership, Leader Hoyer, and your commitment to this issue has been so incredible, and I am so grateful that you continue to make it a priority. And thank you for joining the Black Maternal Health Caucus as a founding member. I know that you can't join many caucuses in principle, so to have you as one of our original members continues to be a powerful statement and an honor. When Representative Underwood and I decided to launch the Black Maternal Health Caucus, we didn't know where it would go, but we knew what we needed to do to elevate this issue urgently. We knew that we wanted to educate our colleagues, to amplify this issue, to raise national awareness and develop legislative policy solutions. Since the launch of the caucus in 2019, Congresswoman Underwood and I have talked about how these terrible inequities in our society and in our healthcare system have stolen countless moms from their children. For every mother lost, there's more than 70 near misses. And for me, like countless others who are dedicated to this effort, it's a pretty personal issue for me. It's very personal. My interest in this work began more than 15 years ago when my daughter, Janelle, who's now a principal here in North Carolina, almost became a victim of this crisis. A physician overlooked her complaints of pain in her abdomen. They didn't listen to her needs as a Black woman. And so dismissing that pain almost cost her life, as well as my granddaughter who just turned 15. And we know that there are thousands of stories like my daughter's of women birthing people and their families dealing with severe morbidities or worse, the loss of a mother or a child. In the richest nation in the world, we know that we can and must do better. And which is why I'm excited about the Black Maternal Health Momnibus Act that Representative Underwood and I reintroduced in February. You know, in the Congress, when you don't get it all the way through, you go back and do it again. The Momnibus is a comprehensive 12-bill package that addresses existing gaps in maternal health legislation that tackles every facet of this unacceptable crisis that disproportionately impacts Black women. It makes investments in addressing the social determinants of health and community-based organizations, and in the growth and diversification of the perinatal workforce. It also makes improvements in data collection and quality measures. It incentivizes the development of digital tools like telehealth, and it encourages the study of innovative payment models. In addition to direct efforts to improve Black maternal health outcomes, the Momnibus focuses on high-risk populations, including women veterans, incarcerated women, and Native Americans. It amplifies an environmental justice lens because recent studies have reinforced the linkage between man-made climate change and the toll that it takes on pregnant women and their infants. And the Momnibus provides critical funding for community-based organizations and perinatal workers, doulas, midwives, lactation consultants who are doing the work right now to save Black mamas and babies, especially in communities of color. But most importantly, this bill truly centers Black mamas, using the reproductive justice and human rights framework as our guide. It was crafted with Black women, by Black women, for Black women. This year, I'm excited about passing it into law this Congress, and these two gentlemen who are working with us in the House, Leader Hoyer, Representative Brown, we know it's going to happen. Representative Underwood and I, we're going to stay on it. So with the leadership in the House and the Senate and the White House, we're pushing hard to get the bill over the finish line because we know that our mothers deserve better. So I'm hopeful that the discussion today goes beyond words and that we're able to translate into action because we have solutions. We know what needs to be done to begin saving lives today. So thank you all. I look forward to hearing from our speakers about the work that they're doing in this space as well. Thank you so very much.
Well, thank you very much, Congresswoman Adams. And now Congresswoman Underwood.
Well, thank you, Leader Hoyer, for having me. And I am so excited for today's discussion. I am so grateful for your membership and participation as a founding member of the Black Maternal Health Caucus. For those who don't know, Leader Hoyer was there with us when we announced the caucus. He was there with us at our stakeholder summits. I mean, he's been there for every major milestone that we have had as a caucus, and it's just extraordinary. And it's something that I personally do not take lightly, and I want to say thank you. I am also really excited that Congressman Brown is here with us today. Prince George's County is such an important community. You know, I spent some time in Maryland when I was at Hopkins. And so when we talk about these disparities, it's something that I really understand. You know, Maryland has an elevated maternal mortality rate in a similar way that Illinois does. And so when we do this work, yes, it's important to have a national lens, but we know that we can have an impact right at home. And I am grateful for your commitment, Congressman Brown, in working with Alma Adams and I to get this done. And obviously, Congresswoman Adams knows how I feel about her, but it is just a joy to do this work with her every day. And I'm so excited that we can have this discussion. So we've made a lot of progress with the Black Maternal Health Caucus since we came together in April of 2019. We've been raising awareness about this disparity, not only in maternal mortality, but severe morbidity, as Congresswoman Adams described. We just completed Black Maternal Health Week, which if you all didn't have a chance to join the Black Mamas Matter Alliance and so many of the other groups in highlighting and spotlighting you know, what we're seeing in our country, there's so many videos that you can watch online. And I would encourage you to just take some time on YouTube and do some exploring because this is an issue that touches all of our communities. And we were so delighted that our Senate lead from the Mommy Bus, then Senator Kamala Harris, is now our vice president, and she's brought the same commitment to ending our nation's maternal mortality crisis to the White House with an amazing proclamation for Black Maternal Health Week, with the roundtables that they've done at the White House. And I'm really looking forward to continuing to partner with the Biden-Harris administration to get this Mommy Bus across the finish line. Congresswoman Adams told you a lot about the Mommy Bus. I'm going to tell you about a few other things. Like we've been working hard to secure funding for key appropriations like the Maternal Child Health Block Grant Program, the Maternal Mortality Review Committees, which I believe you have in Maryland. We have them in our state and so many other states across the country, and to continue to invest in maternal health research at the NIH. We also did pass the American Rescue Plan, which in the American Rescue Plan, we have a postpartum Medicaid expansion so that those states that didn't expand Medicaid and have the eligibility cutting off at 60 days postpartum, they now have an opportunity to cover those birthing people in their the full postpartum period. So for a full 12 months, it's extraordinary. And that is the single best thing that we can do to save moms' lives in this country. And we got it done. We got it done. Thanks to Congresswoman Robin Kelly's leadership. And then obviously we have the Mommy Bus, recognizing that Medicaid, while it is an important tool and intervention, does not address the whole problem. And so we're trying to be comprehensive in our solution. So we look forward to hearing more about what's going on in Maryland, how you all are tackling these issues, and you know, working together to continue to build upon the momentum to get all of this legislation signed into law. Thank you for having me.
Well, thank you very much, Congresswoman Underwood. I don't think I mentioned in her introduction, she's a member of the Appropriations Committee. So when she talks about appropriating money, she's at the table when that's done, and she brings this issue up. And of course, Alma Adams, a key member of the Education and Labor Committee as well, a number of other things she heads up, too numerous to mention. But I mean, these are real leaders in the Congress, and they're focusing themselves, and they are focusing all of us on this critical issue. Okay, Antonia, should we go to the health officers? Is that the deal?
Yep.
Okay. Well, let's go. Let's start out. We'll go alphabetically by county. So you know, we don't want to So Anthony will start out. Anthony, you want to, Doctor, we won't take a lot of your time, but Dr. Kellyanna Raman, who is the health officer in Anne Arundel County. Doctor, thank you for joining us once again. We've been pretty consistent viewers on Zoom calls lately.
Yes, we have, Congressman Hoyer, and thank you, to Congressman Brown, Adams, and Underwood. I'm gonna try to keep myself really brief because I know there's others who want to talk. I'm just really happy about the expansion of the Medicaid benefit period. I think that's critical. That's actually one of the things that we know is critical in that 1 year postpartum period in order to get women the care that they need. One of the things that we are really keyed in on is how to make sure that we have evidence-based care coordination models and we're funding them. These programs were really the core of public health. And I think it's challenging for health systems to do that kind of work, right? That's very public health oriented in terms of we want to reach people before they hit that healthcare radar and put in those preventive services and those care coordination services. And so I think that's a key thing that we're focused on. Things like home visiting, chronic disease management, family planning, particularly. I think that's really a key part. One of the things we want to make sure we're doing is that we're giving women the tools to do family planning and also to identify pregnancy when it happens early so that they can get into care early and get into culturally appropriate care as well. And I don't remember if it was Congressman Adams or Underwood who mentioned doulas and nurse midwives. And that's really a key part of programs that are showing a lot of success in terms of decreasing maternal mortality in Black women and women of color. And it gets to that issue of preventive care and getting outside of the kind of the medical model. And I say this as a doctor, there are limits. There are limits to what the medical system can do, and we can't keep pushing more into the medical systems. We have to push it outside of it and upstream. So I think focusing on that is key. And then also one of the things that we're doing in Anne Arundel County specifically is looking at substance exposed newborns and doing that multidisciplinary work around social services, health. Our Healthy Start program is a part of this. And of course, our 3 birthing hospitals, Anne Arundel Medical Center, Baltimore Washington Medical Center, and Harbor Hospital, to make sure that we are intervening early, particularly for those women who have substance use issues, so that we can get them the care that they need and the behavioral health care that they need. One of the bigger challenges those women face is the fear of losing their child, both the one that they're pregnant with, but also other children. And so getting them that care and that care coordination is really critical in both improving those outcomes, but also reassuring them that this is going to help keep their family intact and not sever those relationships. So with that, I'm going to stop there and I'm going to turn it over to my next colleague.
All right, thank you very much, Doctor. And Dr. Lawrence Polsky with Calvert County. Doctor?
Hi, and I apologize because I missed everything up before Nilesh. I had a pre-existing commitment, and so I'm joining late coming in. I'm also not used to using the earbuds, but I've tried to jump on early, so hopefully audio is okay. So to kind of pick up on what Nilesh said, I think the underlying theme to what he mentioned is that there is no one entity, no one organization that can take on this problem. And I think coming from the clinical side, that a lot of OBGYN offices almost give up, that this is just way too big of a problem to tackle. And so long-term success, I really think, is critical to have coordination, which has lacked between private healthcare and OBGYN offices, what happens in hospital labor and deliveries, and then what happens postpartum with what happens in the public health sector. So as Nilesh mentioned, the recent passage in Maryland of allowing women to continue to keep their Medicaid insurance through a full year afterwards, I think is extremely important. Another component is what happens in pediatric offices, that women don't always keep their 6-week postpartum checkup, but almost always they bring their children in at that 2-week well child visit, or sometimes even a little bit earlier than 2 weeks, that we miss a potential avenue there to continue to engage. And so I know that locally we are working to expand out our program for women who are dealing with substance use to then follow. We now have a peer support staff who is dedicated solely to postpartum, and she will be working with the pediatric offices to make sure that we continue services. Nilesh also mentioned about the importance of contraception. That is historically fraught with all sorts of issues when we talk about minority health disparities. And I think sometimes there's a reticence on part of some clinicians to have those really in-depth discussions. And then women who belong to various minorities lose out on the opportunity, and then often, in some cases, end up with a pregnancy at unexpected times, where they're not at a point in their lives where they can manage well. So, there's lots of different components of this. And I think the important, both from a local level and a state level, is to key in on maybe 2 or at most 3 of those areas. You can't do everything simultaneously. Make real progress in a couple of those areas and then build from there. This will be an incremental, maybe over the next decade to honestly 2 decades, as we both change attitudes about healthcare and work on partnerships.
Larry, thank you very much. I know Larry and I had a long conversation about our vaccination system in Maryland and how we were underserving some of the most vulnerable areas of our state. So Larry, I appreciate your efforts. Dr. Diana Abney from Charles County. Doctor? I think you're on mute, Doctor.
Sorry about that. Good morning, and thank you for having me with you. And also thank you for convening this. It's wonderful and well needed. I'm always at a loss because I'm behind Anne Arundel in Calvert County, and they tend to say almost everything anybody else could say. I want to thank Larry, for talking about the importance of the pediatrics in dealing with maternal health and also in bringing the pediatricians into it. So I'm going to start there. One of the things that pediatricians can do is they do screening for maternal depression, which is very important in maternal health. So pediatricians are doing that in their office now. And it is true that we often see the parents, the mothers, more in the beginning of the child's life and in their postpartum period than do their obstetricians. So partnering with the pediatricians is extremely important. One of the other things, and it's something we do here in Charles County, is looking at the mother's health both before and during her pregnancy, trying to make a difference in getting her prepared for contraception and pregnancy. So looking at high blood pressure, diabetes, and all of the chronic illnesses that people have, many of which disproportionately affect African Americans and other minorities in our country. And then working with our social service partners to make sure that any of the services that are available to our mothers are available to them. And last but not least, I just want to talk about the fact that once the baby is born, we don't just forget about the mother. And I'm so happy, like everyone else, that the mothers can have their insurance benefits for that full 12 months of their postpartum period. But we also help with that in making sure that those mothers that we didn't connect with will be connected with after the baby is born and provide services for not just the babies, for the mothers, but also for the mothers, down to very simple things like connecting them with physicians, connecting them with mental health, specifically connecting them with substance use disorder treatment programs, and making sure that they, as Larry said, that Dr. Polsky said, that they understand that being in treatment and being involved in social services does not mean that they're going to lose their children. It also means that they're going to be able to learn how to deal with their substance use disorder and also learn how to keep their family together. Thank you. I'm sorry, Representative, I can't hear you.
Come on now. Oh, there it goes. Thank you, Dr. Dabney, very, very much. Appreciate it. Now we'll go to Prince George's County, which is the largest county that Anthony and I represent. As I said before, it's approaching 1 million people. It's over 900,000 now. Dr. Carter?
Thank you, Congressman Hoyer. I really appreciate you having me on here with my colleagues. And I really appreciate having Congresswoman Adams and Underwood there, their excitement. And of course, Congressman Brown. One thing that Congresswoman Adams said is that I take this personally. I did intensive care neonatology for 30 years in Maryland and Philadelphia. I've seen women not make it out of a C-section and having to talk to a parent and parents, a single parent at that point who has a baby that I was able to take care of, but also have to talk to them about the fact that their spouse just passed is a very difficult thing. And that's happening way too often in the African-American community. And here in Prince George's County, we have a significant number of African-American and our rates now are relatively high. We have 3.74 maternal deaths per 100,000, and that's greater than the standard here in Maryland. So I have, and our colleagues have been taking various approaches, but I have leveraged what Congress Brown's Health Enterprise Zone allowed us to do here in Prince George's County was to take a more population health management approach to not only keeping people out of the emergency room, but now we've learned lessons in care coordination, and we're applying that now to maternal child health. It's very, very important that we have a systematic approach, a high-level systems approach to this. It just like my colleagues have said, this takes a village to actually do this, and it's not just the clinical side that has to improve, but it has to be the social determinants, it has to be the environment. It has to be all of those aspects of public health that we have to manage in order to help our whole population of women be able to improve their health care. And we're taking this very seriously. We're working on a lot of the lessons learned that we have here in Prince George's County in terms of how we approach public health in general. So I'll end there, and I really appreciate this panel, and I appreciate you all focusing on this serious problem that we know we can overcome because it's preventable and we can do it. So thank you.
Doctor, I think that's the key, and I think that's what Alma and Lauren are saying. It is preventable if we focus and apply the resources necessary and the knowledge necessary, both among the medical community and others. So thank you very much. Lastly, but certainly not least, the county in which I live in the southernmost county of our state, St. Mary's County, and Noel Braithwaite, Dr. Braithwaite is our director of the Maryland Office of Minority Health, and wanted to.
We're still trying to get in contact with them. They haven't responded yet, so I think we can move on to Miss Terry.
Okay. Tequila Terry, what a great name. I love that name.
Most people don't have trouble remembering my name.
No, I know. Tequila Terry is the Maryland Health Services Cost Review Commission Director. Tequila, thank you for joining us.
Thank you. Thank you for having me. And I'm so honored to be a part of this conversation. This is such a critical issue that really hits home personally, as many of you have talked about, and is something that is so easily preventable. So I think there's a huge opportunity for us collectively to work together to address this. By way of introduction, I work for the Maryland Health Services Cost Review Commission, and we're the agency that is responsible for regulating the cost and quality of services in hospitals. We also work on the Maryland Health Model, the unique state waiver that Maryland has with the Centers for Medicare and Medicaid Services. So we work very closely with the federal government and with hospitals to make sure that there are high quality services in our hospitals and in various points of contact across the healthcare system. And I want to echo something that Dr. Carter talked about, which is this idea of population health. Under our unique waiver with the federal government, with CMS, we as a state are responsible for implementing what's called a statewide integrated health improvement strategy. And what that is an agreement that we have now, effective January 1 of this year, that really is designed to engage state agencies and private sector partners to collaborate and invest in improving health, addressing disparities, and reducing healthcare costs for Marylanders. And as part of that initiative, there's this tremendous focus on population health, and more specifically, prioritizing maternal health. We as a state have now a specific goal to reduce the severe maternal morbidity rate in the state as a part of the agreement with CMS and their innovation center. So what that means now is that we collectively as a state need to pull together resources and really more aggressively than ever target this issue. So with that being said, there are a number of initiatives that are launching this year that I want to just highlight quickly. A number of my colleagues have talked about the state legislation to support maternal health across the state. There are a couple of bills that have passed in the legislative session to increase access to prenatal care and to require Medicaid to extend coverage. And then we are also working with the Maryland Department of Health, their Prevention and Health Promotion Administration, really to create a statewide plan that aligns and coordinates maternal health efforts. It increases access to maternal fetal medicine, improves quality of care, and then brings care to home and community. Again, sort of back to this notion of we can't just push on the medical system, we have to go to the community and look at those upstream factors. And then we're also working with the private sector. So notably, the Maryland Department of Health Secretary has convened a Secretary's Vision Group where he's bringing together private sector organizations to look at ways that they can contribute to addressing maternal health. And so organizations like Care First have already stepped up to say, you know, they're looking for opportunities for where they can increase awareness, address social determinants, provide information on prevention, refer people to care, and more closely case manage high-risk individuals. So that's an important element of this statewide integrated plan, is that we can't do it alone as government. We have to work in collaboration with our partners around the state. And then we have to track the data. So we have to be able to demonstrate that we as a state are making progress. So we are tapping into the power of our health information exchange to create a statewide data tracking system that is monitoring all of the activities and interventions underway, really in an effort to demonstrate, again, under that federal partnership that we have, that we as a state are making progress, and more importantly, so that we as a state know where to pivot and where to activate strategies. And then finally, our agency is considering a recommendation as we speak to be able to allocate funding specifically to address severe maternal morbidity and fund a number of interventions through a $10 million investment that would be used to activate strategies with Medicaid, the managed care organizations, hospitals, and public health. So there are a variety of tactics and strategies that are being activated under this statewide intervention strategy that we're developing. And it's really an exciting time that we now, again, have this idea of collective impact where we can all come together, contribute, and ultimately make significant improvement in severe maternal morbidity. So I'll stop there, but just want to flag sort of this federal state partnership as one of the additional strategies underway.
Thank you, Tequila, very, very much. Two more, and then we'll go to Alma. If you and Lauren want to have questions of anybody, I'll yield to you on that. But let's go to Steny Lynn Harris, who's the co-founder of the Bloom Initiative and Mommy Up and kindred partner Black Mamas Matter Alliance.
Thank you so much for inviting us to be here. It's an honor to be here with you all. As you all said, my name is Steny Lynn Harris, and I am the co-founder of the Bloom Collective, which is a Black women-led community-based organization in the city of Baltimore. I'm also the founder of Mommy Up, which we cultivate and center liberation for Black mamas. And in addition, I'm a kindred partner of the Black Mamas Matter Alliance since 2017. The Bloom Collective is really what happens when the community calls on you and centers the traditions of our ancestors. I would be remiss to acknowledge the fact that I come from a lineage where my great-great-grandmother, Melissy Brown, was a grand midwife in Seneca, South Carolina, where she gave and helped birth the children on the plantation and throughout the city of Seneca. At the Bloom Collective, we offer perinatal psychotherapy, postpartum and perinatal support groups, lactation support, and we help and train and cultivate and decolonize birth workers. And we must say, since the beginning of 2020, we have helped to fund and to train over 45 Black folks to become certified breastfeeding specialists. In addition, 5 of them have moved on to become internationally board certified lactation consultants. A lot of our work is to go against deficit-based narratives and language, and how those false narratives that are rooted in oppression and racism cause further harm in our community. Quite frankly, we try to get to the root causes, and as Dr. Joya Perry reminds us, is that racism is the risk factor and not our race. Our rootedness is that in fighting the causes of the harm being done to Black mamas and birthing persons, we center the structural determinants of health, which help us get to the deeper rootedness of what has caused the harm and the oppression: enslavement, Jim Crow, redlining, and the GI Bill, which was definitely centered by Jessica Roach in Columbus, Ohio, through Restoring Our Own through Transformation. Through a reproductive justice lens, we assert that all people have the right to bodily autonomy, to have a child or not have a child, to parent that child with dignity in safe and sustainable communities, and to determine their own reproductive experiences, which comes from Dr. Loretta Ross. As one of the contributors of the Black Mamas Matter Alliance Black paper entitled Setting the Standard for Holistic Care of and for Black Women, we centered a vision for holistic care that causes for addressing gaps in ensuring continuity of care, that it is affordable and accessible, while equally honoring that just because something is accessible does not equate to holistic quality of care. We also further outline that in order for holistic care, it must be confidential, safe, and trauma-informed, and we center and unapologetically and advocate for Black women engaging key stakeholders and amplifying the voices of Black women. We center Black and feminist womanist lens and center birth justice, human rights, and reproductive justice. And as a community-based organization, we would love to continue to work with partners to really begin to see community-based organizations as allies and in solidarity working in this work, and actually the folks who are deeply connected to being able to help make the change in cultivation within our own communities. Thank you so much.
Well, thank you very much for the work that you do. And last, but certainly not least, Yema Juliet Sadiq, who's the founder and president of Project Womb. Yema?
Hi, good morning. Can you hear me okay?
We can.
Awesome. My Wi-Fi might be a little shaky. I'm not in my usual location at the moment, but thank you so much for inviting us to be here today. It is absolutely an honor to be here. And, you know, like you said, my name is Yema Juliet Sadiq, and my pronouns are she, her. I am the founding president of Project Women, organizing and mobilizing to protect our bodies. And I'm actually born and raised in Maryland, Moco really, but currently I live in Hyattsville in PG. So and I'm loving it. Yeah, Maryland all the way. And so Project Womb is a reproductive justice advocacy campaign centered around issues including access to abortion and contraceptives, racial violence, medical bias, maternal and newborn health disparities, menstrual equity, voter suppression, and so much more. And today, thank you so much for getting into that. And I just absolutely loved your entire introduction just now, because that just brings me right on into mine. And it's something that Representative Adams actually introduced, because I think that all of these policies and solutions that were mentioned throughout these roundtables are beautiful and necessary, but I we personally don't believe that that's the bottom line. In addressing Black maternal health needs in labor and delivery, the bottom line is we just need to trust and believe Black women when we say that we are in pain, and when we say something is wrong. So that is the emphasis of our advocacy at Project Womb. The issue is that our healthcare system just devalues Black people at its core with constant racial bias. So how are we addressing that with policies? You know, and despite how much income or education that we have, like it was mentioned, when you consider stories like Beyonce or like Serena Williams, who's Black women whose pay just was not taken seriously. And as Steny mentioned, like Dr. Joya Perry reminds us, you know, a Black woman with a PhD is still way more likely to have worse birthing outcomes than a white woman without a high school education. Brings us back to medical bias and just not believing Black women when we say we're in pain, right? And not even just as it concerns the Black birthing process, but Black people in general. Even elderly people, when it comes to Black elderly people being in pain and thinking, well, you know, maybe they are on drugs, maybe they are just not taking it as seriously as it would be to a white counterpart, which is extremely problematic. You know, and there are so many organizations that are working to hold the medical system accountable for devaluing Black bodies, like the National Birth Equity Collaborative, you know, Black Mamas Matter Alliance and Ancient Song, because, I mean, like you even mentioned, Leader Hoyer, but with COVID, it should be obvious that this is a system that ties health to labor, that denies people access to the fundamental right of health based on income and employment, which falls hardest on Black people. So I think that it's important in figuring out the step of translating all of this into action to address medical bias and racism in the birthing room. Thank you.
Well, thank you very much, Em. I appreciate that. Anthony, before I go to Alma and Lauren, did you want to say anything?
Yeah, I just want to say that I'm delighted that Dr. Carter and others mentioned the importance of population health, and sort of in addition to what we're doing on a clinical level, but what we're doing to look at all the different factors that can come together. And I'm pleased that Dr. Carter referenced the Health Enterprise Zone, because we really did focus on that sort of like coordination among community participants in delivering health, whether it's the anchor institutions like hospitals, working with nonprofit providers, working with health practices, but the idea that all of us are working together, sharing information, best practices. So I'm glad that that program is working in Maryland.
Great, and terrific job. Obviously, as all of you know, Anthony was not only the majority whip in the House of Delegates when he served there, was a leader there, but also 8 years as our lieutenant governor and did an extraordinary job. Alma and Lauren, any questions of any of our people that you might, or observations that you might want to make, Alma?
Let me first of all say thank you all. You all have been extraordinary. I was just really moved by the last sister who spoke, Yema. That your name, Juliet?
Yes, ma'am. Yes,
yeah,
Juliet.
You hit all of the points. I wanted to say amen, or a woman, to the comments that you made. Extraordinary. You're right. It has absolutely nothing to do with how much money you have, how great your insurance is. The bottom line, it gets to what you look like, the color of your skin. And thank you so much for hitting those points, because we've tried to do that. And when I think about my bill that I've sponsored, it is, you know, it just makes me think of the young woman who didn't have to. It didn't have to. She did not have to die, and left her son. Actually, there are 2 boys now, and Charles, her son, is raising those boys. I did have a question though, quickly. I want to ask Dr. Nellish. I can't pronounce your last name. but let me just you're from Anne Arundel, right?
Yes.
Health officer in Anne Arundel County.
Oh, okay. So tell me about how you're integrating doulas and midwives and other community-based partners into the care systems, allowing them to maintain independence, but also be respected as care partners in the maternal health care.
Yeah.
I think
So
yeah.
So Congressman Adams, we're integrating them. So those are being done in partnership with the hospitals. Integrating the doulas and the midwives as part of the prenatal care that's being delivered. And so we have, as I mentioned, we have 3 main birthing hospitals that we work with in our county. It's a program called Stork's Nest that looks to address both whatever social needs expectant mothers have, and also to provide that connection to doula and midwife services as needed.
Right. Well, thank you very much. I know we're running out of time. I'm going to yield to my younger sister, the younger one in the house.
Lauren?
This was fabulous. Okay, so I want to thank our health officers for being innovative and leaning in and really just being so creative about opportunities to save lives and build partnerships within your communities. There was some conversation about care coordination, and I just wanted to highlight that the key care coordination provision within our Momnibus bill is in the Protecting Moms Who Served Act. And so if y'all want to take a look at that one, and if you have feedback for us, please don't hesitate to let us know. This is one bill that is bipartisan and it's moving and we're very excited about the progress that we're making there. And it's the one dealing with our veterans. I also wanted to highlight the perinatal quality collaboratives, which I think are another source of real support. We're trying through appropriations this year to increase the resources that we'll be directing to the PQCs. They've been great partners for us in Illinois, and I hope you have that same kind of resource in Maryland, and we're hoping to get CDC some more funding to scale those up around the country. Aspen just put out a new report like over the weekend, maybe on Friday, about maternal health, and it touches on a lot of what you all were talking about. And so not that we all have time to read 150-page reports, but if you do find yourself with that kind of leisure time, I would encourage you to check out that document. And then finally, Congresswoman Adams referenced it, but she's the lead sponsor of the Kira Johnson Act. And I think in particular, that would be of interest to Steny. Just thinking about the work that you and Yima are doing as community-based organizations, we want to be able to support your work. And so this is the bill that offers the grants to community-based orgs that do this kind of deep dive, trusted voices kind of work. And I want to make sure that you know that we're trying to scale up those resources in the Congress. Thanks so much for having me.
Well, Alma and Lauren, thank you very, very much. Anthony, did you want to say anything in closing?
No, just looking forward to working with all of the members of Congress on this important legislation. Appreciate the work that our public health officers are doing, being with us today. Good information. Thank you very much.
Well, thank you, Anthony. And as our health officers know, both Rachel Snyder and Antonia Hill handle healthcare for me. And Anthony obviously has some folks focused on healthcare as well. And any of the health officers, anything you didn't get to say or you want to emphasize to them through Anthony's and my office, we will get to Alma and to Lauren as well, so that you can have input and see as this legislation develops and hopefully passes, that we have dealt with the subject matters that you in our local counties encounter, and you think can get some help through resources or other directives from the federal legislation. So we're ending just about right on time. I want to thank all of you for participating. I know Anthony and I very much appreciate the work that our health officers do, that our state officers do, and that the NGOs do. So thank you, all of you, for participating. And we look forward to doing what America really ought to do, We ought not to be a trailing indicator here. We ought to be a leading indicator of maternal health and survival. Just makes no sense. And I think clearly we know, as has been said, it does not deal with just resources. It does not deal just with access. It does deal with attitudes and racism and a pattern of not paying attention to the concerns of those folks with color, both in the African American community, the Hispanic community, other communities of color. And we need to overcome that. Racism is one of President Biden's focuses of overcoming systemic racism in our country. We passed a policing act, which is very evident. But as I said at the beginning, COVID-19 has made very evident the racial disparities in our healthcare, not only in policing and justice and civil rights, but in our healthcare. And that ought not to be. We need to all work together to overcome that and to ensure equal treatment, equal outcomes. That doesn't mean we can save everybody, but it does mean we ought to save everybody that we can. So thank you all very, very much. And again, Alma, Lauren, thank you for your leadership. Thank you for what you're doing in the Congress and in this country. And thank you for joining us today. Okay, everybody. Bye-bye.
Thank you, everyone. Thanks, Alma. Thanks, Lauren.
Thank you.
Thank you. Thank you. Thank you. Thank you.
You bet. Bye-bye. Bye, Lauren.